Welcome back. I'm Dr. Nestor Rodriguez, ER physician, co-founder of Carbon World Health. And today's conversation is one that every parent, educator, healthcare professional, and conscious consumer needs to hear. We spend so much time talking about nutrition, exercise, supplementation, and optimizing health. But what if one of the biggest impacts on our health has been sitting right in front of us the whole time? Today, I'm joined by Dr. Manasa Mantravadi, pediatrician, entrepreneur, public health advocate, and founder of Ahimsa, a company on a mission to rethink what our children eat off of, drink from, and interact with every single day. After seeing firsthand the hidden dangers of toxins and heavy metal exposure in children, Dr. Manasa set out to challenge the status quo and create safer, healthier alternatives without sacrificing practicality or beauty. This conversation goes far beyond products. We talk about the hidden environmental impacts on our health, what parents should actually be paying attention to, the truth about toxins and heavy metals, building a mission-driven business with purpose, how small daily decisions can create massive long-term outcomes. Because optimization isn't just about what we put in our bodies, it's also about what we surround ourselves with. Dr. Manasa, welcome to the show.
I just upended my entire career to do this,
Right.
right? And I'm taking a big leap of faith, being in front of the cameras and putting my name and face on this and my family's name. So it's like I watch that show with such a different take now.
Correct.
Because it's not just a TV show, that's a real entrepreneur. That's somebody who's really working their ass off, really put a bunch of money and time and sacrifice.
Right.
And so the way that you get treated literally sticks with you.
Correct.
So Kim and Lori were so kind to me, even though they do you know what I mean? And
yeah,
that's-
no, and
that's
I
stuck
think
with
that's
me.
the thing that and you probably talk to us about the entrepreneurship, right?
Yeah.
You can still choose what type of entrepreneur you want
Yes.
to be, right?
Yes.
Like you could always give back, you could always bring
That's
someone
right.
ahead. Like you guys have a women's group here, right?
Yeah.
That's empowering
Yeah.
to say. We were in a men's group and it's like, people say, is that bad? No, it's not. Or a minority group, it's like, no, it's you make a negative connotation.
Exactly.
But if you look at it, we need people that are the same with us to try to help us move.
Yes, and you need to be able to see each other. You need to be able to see yourself out there doing
Correct.
the thing. That's why Sanera, she built a $1 billion company. She is a female Pakistani mom of two young
There
kids.
you go.
And so I saw myself and I saw her handling all of entrepreneurship and being there for her husband and being there for herself and being there for her kids. And I was like, okay, what is she doing? Because that's the type of entrepreneur
Right.
I want to be.
And you're right to that point, because even the cultural part, right? So
Yeah.
we're in a mix.
Yes,
So if
totally.
you look at my wife, you would think she's white or Latina, but she's not.
Yeah.
So even that, I wrote a book recently that's about the publish of like assimilation versus not. People would say assimilate,
Yeah.
but if you think about it, so she would say, well, why didn't your parents learn English? Well, why
Yeah.
didn't you learn Spanish? to
That's
promote
right.
it, right?
That's
Like,
right.
why is it just one way
Yeah.
or the other? And I get it, right?
Yeah.
Like, if you take the emotion out of it, it's
Yeah.
like how do you want to relate?
Yeah.
And it's not about the language you speak, it's just
Yeah.
the intention that you want to relate with someone on the other side.
Yes.
It's the
And
same
that's
with
like human nature
correct,
to relate with
correct,
another human.
correct.
I know.
and same with entrepreneurship, right?
Yes.
The two things that I learned were one,
Going
to
through.
some degree, emotions don't matter.
Yeah.
Right? Like we
Yeah,
get
yeah, yeah.
hurt, right?
Yeah.
Like you experience that.
Yeah.
But you can still do it nicely, but at the end of the day,
Yeah.
they don't care. Like
They-
they're seeing numbers, they're seeing
You
profits.
know-
Can I create this? You could be saving lives, which you are.
Yeah. But they just see.
dollars.
But I will tell you, that's what I wrapped if it's recording.
It is. We're
Okay,
good, we're
great.
good,
So
we're
'cause
good.
these are great short form. So I will tell you one thing that I had to wrap my brain around a few things on how to be a leader in the business space. And I had a mentor who did kind of, consumer product goods. And he said, okay, you're going to have to be a little bit mindful about what type of leader you are. He's like, you are a physician. So you are going to lead with kind of heart.
Right.
Okay. He said, but the best CEOs lead with heart, but they operate with brains.
There you go.
And I cannot tell you, once I started really being like, okay, this is my patient, my business is my patient, I got to keep them healthy, which means I need to know my numbers. I need to know my team. I need to know how to operate this business. I need to have every KPI, and I need to know what to do, because if I'm flying blind, I don't know what levers to pull.
Correct.
And so it's very easy for us in medicine, because we know, we round on a patient, we see their vitals, we see their
Right.
labs, you know what to do next. But then we step into this kind of CEO role, and you're like, I don't know how to read a P&L. I don't know how to read a marketing dashboard. And it's like, well, you can learn that, but now you're not flying blind. You're not flying blind, kind of trying to keep your business healthy.
Correct.
It's like,
Correct.
and so I think when people can wrap their brains around, you would never take care of a patient without the proper information. You should never take care of your business without the proper information.
Exactly. It's different data, right? We're used to having all this data. It's just like a
Exactly.
different metric than how you do it.
That's right.
So with that, one of the questions I always ask, especially physicians, I'm
Yeah.
excited, right? Because we're not entrepreneurs. And what do people
Yeah.
say? We're probably worse with our money, right? That's the
Because
stereotype.
no one ever teaches us. That's not our
Correct.
fault. Yeah.
Correct. To that point, right? It's not that we can't. It's just that's not what we think about or learn on that.
Yep.
So what was the calling for you? Obviously being a pediatrician, endocrinologist.
Yeah.
If I think back, like similar to me in academics, to me it was running the residency program, then becoming a chair, right?
Yeah.
Like that's kind of what we were taught.
Yes.
So at what moment where you're like, there's something out there and I want to pivot and I want to create this special product?
I wasn't thinking about entrepreneurship or anything. I literally was doing pediatric endocrinology, seeing, in medical school, we learned type 2 diabetes was an adult onset diabetes.
Right.
And by the time I finished my training in endocrine clinic, we had literally clinics filled with children who were 9 years old with type 2 diabetes. And so I was kind of doing that, the treatment-based kind of interventions that we're forced to do, right? And then the American Academy of Pediatrics in 2018 came out with a formal food health policy that talked about the impact of plastic additives, all of these different things on children's health. And so it resonated with me because I was seeing it in real life. I was seeing it in my patients. I was seeing these huge changes in what children's health look like. And so when they said, don't use plastic, use glass or stainless steel, I'm like, well, I'm Indian. We eat off of steel, right?
Okay.
And that's like kind of what I thought. I said, okay, we're supposed to now recommend glass or steel. But the industry doesn't offer glass or steel for children. And everywhere you go, right? Like you have kids, it's plastic.
Right.
And so it's like no wonder with environmental health toxins that we see these outcomes. But like we as physicians can make recommendations, but parents can only follow those recommendations if they have solutions. And so I was like, well, let me just, try to create something that allows parents to follow medical guidance. And then I decided I was going to just Google my way through how to, first like figuring out steel manufacturing, figuring out the color. The color actually, my husband is a reconstructive surgeon for head and neck cancer.
Okay.
And so one day I was looking, he had some jaw implants that were different colors.
Oh, wow.
And I was like, what is that? How are they getting blue and purple on these implants? And he said, oh, it's titanium. So basically I learned the process of kind of titanium coating in medical instruments, right?
Wow.
With stainless steel from India, and then kind of married the two, and Ahimsa was born.
There you go. That's awesome. And that's the other thing when you think about it culturally, right?
Yeah.
Because if you didn't come from that, right? You weren't,
Yeah.
you didn't have that. You probably would have read that same paper and been like, all right, cool. What does that even mean?
Exactly.
Right? To you, it's like, no, I've seen it done.
Yes,
How do I do it?
that's right.
And then talk me through that process, because that is what I laugh. When I look at it and I'm like, man, this is pretty slick. Like, not only to do it, but now this looks cool because I'm looking at it as a kid, I'm going to want to do this.
And
Right? Because if you give me a kid, the other steel thing that I could imagine that most Americans would be was like, you're in prison, here you go.
or the camping,
Like,
right?
Yeah, like, where you
And I
just, like,
think that is, so this is why I think every physician, like we need more physician entrepreneurs, because there is so much in our brain that we already know. For example, pediatric development, childhood development, right? You kind of alluded to it. You need to get a child to get really engaged, right? So that starts with visual, it starts with sensory, so that's why they put, characters on the plates, right?
Right.
And so I was like, how can I compete with that? So I knew what it would take for children to get excited about mealtime. And I knew that mealtime and nutrition was the key to health for children. And so infusing these kind of just everyday things that like we know as physicians into products, into companies, we see patients, of all backgrounds, right? Like we see human nature in such a different way than most entrepreneurs because we're one-on-one with those patients. We see them in their most vulnerable states. Like we know the pain points And they're really common amongst all people. And so like being able to take that kind of experience with our patients and our medical knowledge and infusing it into solutions, I think doctors can really step out of their kind of clinical settings and add even more. Doesn't mean that we all have to like stop practicing medicine. It just means that we have so much to offer the world that we don't know that we have.
Awesome. No, and I agree. I completely agree. Obviously, being an entrepreneur and stepping out, I'm still in both of those spaces. Which kind of you keep your foot in one and the other. But I think you give context to like, hey, this is what I would normally tell you. This is why I would tell you this, and what's the difference for right? So moving from the business, obviously entrepreneur is not easy, and I always laugh or I poke, or even I tell people to poke me when I'm speaking at like, we look pretty, we say we're successful, we're that, but like behind that curtain, there was a struggle to do it, right? So how do you're a mom, you're a physician, you're an entrepreneur, right? That in itself is a job by itself, but you're carrying all those three hats, and I'm sure you're carrying other hats, but how do you know that your cup's not empty? And if it is, how do you know that you have to refill it before a crisis happens?
You know, I think that is a learning. So it's interesting. Each of those three roles you just mentioned, entrepreneur, mother, and doctor, and I would say specifically also even females, right? 4 roles. All of those roles really were ingrained to just get everything else taken care of. And so the first few years of entrepreneurship for me was a deep, dark rabbit hole. It was bad, right? Because I just kept really just doing I launched right before COVID. I launched in January 2020. Okay.
So even another layer.
So I was working on the COVID unit. I was like doing some hospitalist medicine, working on the COVID unit. My husband was working also as an essential worker with Airway.
Right.
And then my kids were home, you know, like doing all the remote
where you guys are at, right? Like.
And I would come home from an overnight shift, be sending kids to the ICU and just really bad. And then I have to get up and write an email campaign and not knowing anything about marketing. So I was giving so much of myself and I was running on empty, like literally running on empty. It was affecting my sleep. It was affecting my mental health. It was affecting relationships. And what I quickly realized is what you just said. If I don't fill my cup, this is all going to implode. Right. And so one very practical thing I did, that's like a tip, go on a trip. Like when you go on your trip with your family, literally leave everything behind. Leave your phone behind. They're with you, right? You don't need them. Like your work, your laptop, leave everything. And I did that for the first time a few years into the business. And we went to Yellowstone.
Okay.
And I completely unplugged. I refilled like my own cup. I came back so much better. And even my investors, they were like,
noticed it.
They said, what happened? And I made that a routine. So I made that, like, I heard this saying, be where your feet are.
Okay, I like
So it's like, okay, when I'm a mom, I can't do the other things. Right? When I'm CEO, I got to do that thing. And I can't, do all the other things. And so be where your feet are is a good way to remember. You might wear every hat.
Right.
But you can't wear them all at once.
Correct.
And I had another mentor say, women, they always say like, you can't have it all. And she's like, actually, I would change that. You can have it all, just not at the same time.
Yeah, exactly. And that's true, right? Because the outcomes are events you can't control, but we can control our response, right?
Yeah.
So a lot for me when I went through all this is I have to look at what do I have influence? What can I influence?
Yes.
What can I control and what do I need to let go?
Yeah.
But it's hard for us because we try to control things.
Yes.
Right?
Yeah.
And then it's that role that's there.
Yeah.
So what would you say in terms of like for aspiring entrepreneurs? So one, you have what I call a double impact female, which we always like, that is something different, right? That I can't, even when I speak with hormones, I'm like, guys, I could fix them in 2 minutes. They're simple. We're simple beings.
We're just
females
complex.
are a little bit complex. But then you take that away, then also your cultural background, right? Which that comes with different expectations, I would assume, right? The different thought process, different goals of what you want. So how do you include all that in what you're doing so that you don't feel like you're selling out? One of the books I wrote was about that, similar versus selling out. So how do you keep your true self, but still working in this,
I just always remember my why.
Okay.
It's so simple. I just remember why I'm doing this. So like, I didn't go about this venture, right? This journey thinking I'm going to launch a company, I'm going to make a product. I was literally like, how can I help children be healthier? Because I can't keep doing what I'm doing, right? So how like, I'm so passionate about children's health, right? Including my own children. I'm so passionate about planetary health and all of the things that we're doing to our planet, because we're literally passing it down to our children, again, including my own children.
Right.
And so for me, this was just like, I always remember my why. And I know that each part of my why is like, there has been a contribution of me being a female, me being Indian from India, me being a physician. And it's like those different hats that I worn kind of contribute to the why in like a certain way, right? And so like, that's how I do it, because otherwise it feels really overwhelming, especially with entrepreneurship or even medicine, right? Like
medicine
just
alone,
like you get burnt out. But if you go back, and motherhood, by the way, you get burnt out, right? And so it's like, if we just always go back to our why, like what is the greater purpose here? Like, and then you see your kids' faces. You're like, that's my why. You see your patients' faces. You're like, that's my why. That's how I keep going. But at the same time, you got to stop and fill your cup, because the way that I'm able to function as a mom, show up as a mom, show up as an entrepreneur, show up as a physician, I'm so much better when I'm taking care of myself.
Correct.
And that was a hard lesson to learn.
Correct. I think it just starts in med school, right?
Yes.
Everything's about, right? So I had someone earlier, we talked about sleep, and it's like, we're the worst. We don't sleep in residency, right? We brag about not sleeping,
36
right?
hours,
We do.
go.
And we're saying sleep better. They're going to be like, yeah, okay, cool. That's what you
right.
told me you're not doing,
Right.
right? In terms
Right.
of that stuff. So I'm going to allow you to brag a little bit here, because you should, and you should be proud, and I'm proud for you. So where can we get this if people want to get this?
Yes. So you can go to ahimsahome.com. It's AHIMSA home.com. The company is named Ahimsa because it's a Sanskrit word from India, where I'm from.
Okay.
That means avoiding harm. So avoiding harm for children's health, avoiding harm for the planet. And it's the first oath we took as physicians to do no harm. So
there you go.
You can go to ahimsahome.com. You can find us on Amazon, and we are soon launching at target.com, so you can find us there too.
Awesome. I appreciate it. Thank you for taking the time. And Mark, by the way, you were nice, but here she is succeeding.
Out, man. You can still call me. Hoosiers, and we're doing so well in football, man. You got, like, look at this.
They are. As a Badger, we suck this year, but
this is tailgate written all over it, Mark. Call me. I'll forgive you.
There it is. Thank you. I appreciate it.
Dr. Manasa, first off, thank you. Not only for joining us, but for the work you're doing to bring awareness to something most people never even think about, yet impacts families, children, and long-term health every single day. I think one of the biggest takeaways from today's conversation is this: health optimization isn't always about doing more. Sometimes it's about becoming more aware of the choices we make, aware of what we normalize, and aware that prevention often starts with the smallest daily decisions. If today's conversation made you think differently, challenged your perspective, or helped you realize there may be blind spots in your own health journey, do us a favor. Like, subscribe, and share this episode with someone who would benefit from hearing it. And if you want more conversations around health, longevity, performance, and living with intention, make sure to follow us